Welcome to this important session. Today I will discuss how to do effective handoffs. Handoffs is transferring the information during transition of care. Why handoffs are important? Because study has been shown that medical errors is the third leading cause of patients' death in the US. When I was an intern and resident, I learned that planning ahead about handoffs and knowing the mnemonics, how I should write in the EMR or electronic medical record, as well as how I should tell my co-workers was really life-saving for me. So if you want to learn the techniques and tips, please continue watching. The research has been shown that communication failure during handoff can cause 30% of all malpractice claims. Electronic medical record is now quite widely prevalent in North America. However, verbal communication can never substitute only the EMR. Medical error due to ineffective and inefficient handoffs is quietly prevalent worldwide. The study has been shown that a standardized handoff tool was able to reduce medical error nearly 23%. Imagine if you are able to learn and implement this handoff efficiently, how many lives can be saved. I cannot stress enough that how much these handoffs are critically important for patient safety and patient care. Now, a couple of tips. The most important thing is to remember your colleagues are taking sign out for many patients. So likely they will not remember everything. So what you will do in that case? Always bring and talk about your sickest patients first. This is the number one tips you need to remember regarding handoffs. Provide a rationale for any instructions and give them further directions. For example, do not just tell check CBC. Tell them when they should look for that result. Give them that specific time and also tell them the transfusion goal, because for some patients transfusion goal could be hemoglobin 7 or some patients could be 8. So give them that specific cutoff for your specific patient. Always encourage questions, that you will be reassured that you were able to give them all the information in a correct manner, as well as your co-workers will know that what they need to do very clearly. In addition, always make sure you are writing all this key information clearly and concisely. So when you are writing your sign out or handoffs, as well as presenting, I found these two mnemonics, which I will share in this video, are very helpful. They were really life-saving for me during my residency. So the first one is I pass. I stand for illness severity. Specifically mention that whether this patient is stable or unstable, or you are just closely monitoring or watcher. P stands for patient summary. Give them brief information about the hospital course. Remember, you do not want to tell them all the detail. Otherwise, they will be information fatigue. You want to give them clear and concise information. A for action list, to-do list, what they need to do for your patient. S for situation awareness and contingency planning. That means you can predict or let them know what you are predicting for this patient in near future and what they need to do if that thing happens. For example, if you feel that one of your patient might deteriorate quickly, so tell them that and tell them what will be the next instruction, that they should have low threshold for ICU transfer. S for synthesis by receiver. Encourage them to read back to you the instruction and also questions, and encourage them to let them know that did they really understood all the information. There is another mnemonic, sign outs. S for sick and code status. I for identification like name, age, gender. G, general hospital codes, again briefly. N for new events of the day. For example, maybe your patient started to require oxygen from today, or maybe the oxygen requirement got higher. So tell them, because this is really pertinent for them to know. O, overall health status. Is the patient improving or is this patient getting deteriorating? U for upcoming possibilities with plan. T, tasks to complete overnight. S, summary or questions. Between these I pass or sign out, you can choose either one. You do not need to choose both. I believe either one will be able to cover you all the important points which you need to write, as well as verbally communicate with your co-worker. So this is very important, this sign out or handoff for patient care and safety. So what you can do to ensure that you are doing this job right? First of all, limit any interruptions. Do not use your phone during that time. It's just few minutes, like 5 to 10 minutes. Stay away to using your phone. And also, if you're in a room, there is like, a lot of noise or any kind of music going on, please turn off that music and try to always do your handoff in a quiet environment so that you can give your 100% concentration as well as your co-worker. Take notes of important points when you are taking handoffs. It will be a life-saving for you, I'm telling you. Always ask questions. If you have any doubt, if you need to clarify, always ask questions. Also, if it is a sick patient, there are a lot of things going on, it's always a great idea to read back to your coworker to make sure you really got the point. Finally, keep track of your to-do items. If you need to follow 10 laps, and if you are keeping track of all of them, when you are finishing your shift, it will be much easier for you. Because I know that one of my co-worker, they were not able to do all the to-do list, and then they have to come back to the hospital and finish that task. You do not want to do that. You want to be efficient. So always keep track of all your to-do list when you are doing this cross coverage. Remember, the more you practice, the more you will have progress. I wish you all the best. Please share this video with your friends and co-workers whom you believe will be benefited from these important lessons. I want to hear from you that is there any particular topics you want me to make video, and I will be happy to work with you. So please mention in the comments if you want me to talk about any particular topic. Again, as always, my best wishes for you. Take care. I will see you in the next video.